Dr. Tom Shieh and Dr. Hoa Nguyen standing by. We'll go ahead and give an opening to Dr. Shieh here, and then we'll fold in Dr. Hoa into this conversation. Hi, Doc. Good morning, Dr. Shieh. Thanks for coming on.
Oh,
Unmute.
yeah. Are you there, Dr. Shieh?
There you
Yeah,
go.
I'm here.
Right
I think
on.
Jason muted me, but it's okay. Go ahead.
Here we go.
How dare you?
Doc, good morning. Nice to see you. It's been a minute.
Yeah, it's good. It's good. I'm in Honolulu right now, so I'm using my small iPhone here. I don't have my computer with me, so let me just put it on the table and make sure that it's okay. Yeah, you can hear me okay, right?
Hear you. Very good.
Yeah. Yeah.
I can also hear myself.
Oh, what is that?
What is that?
Oh, there. Okay.
How's Guam doing?
It's snowing.
Hawaii's doing great. I can tell you that. Everything's opened up. I think we're into our second, it's been 2 months, going to a third month of pre-test arrivals. So it's opened up pretty well. So I think it's doing pretty good. I think our rolling average is about 2% over the last couple of months.
Wow.
So I think that's pretty darn good.
So
I
there's-
see
that
Christmas
car
lights
score.
up.
What's Hawaii's
Car score.
What's
you're gonna
Hawaii's
get me
car
started on
score?
the car score. We don't use car scores here. I think I think Guam is the only place that actually using the car scores, you know. But you know, like I said, the car scores, a couple of things on the car scores. For example, like the retransmission rates, you know, those are dependent on contact tracing. Right now, just the other day, or just 2 days ago, one of my patients saying that, hey, you know, one of my family tests positive. He was never got a call from public health until 3 or 4 days later. You know, you can't do contact tracing like that. Contact tracing needs to be done within 24 hours. And Hawaii is doing a pretty good job in contact tracing. So I think that's pretty good. In addition, I think the pre-test, the reason why the pre-test is good, also because you're screening people if you come on board. So, you know, you count those tests too. You know, you want people to get tested. And the way Hawaii is doing it is that if they get pre-tested and come on board, there's no quarantine. I think that's good. I know that Guam is wanting to use the antigen test. I think that's the new thing that Guam wants to use. But you got to remember now, the federal government spent almost $800 million to buy these quick tests before it was even approved and before any scientific data was issued. So that was kind of a Trump or the White House deal with it. Now we got stuck with these millions of tests. I say use them. I think it's okay to use them. But I think the FDA has issued a guideline to use that, which is the use it on symptomatics. Even public health issue a guideline to memo to all the doctors to use it for symptomatic patients, not for asymptomatic. And certainly, I think when the U.S. Surgeon General had in the conference had mentioned that we should use that for serial testing. Serial testing is not something that you test one point in time in a mass testing, type of a protocol. The serial testing is that you use it, you test the same person over a month, over a week's period. You get tested today, you get tested next week, and you use that for serial testing, certainly not in a mass testing situation. So that's just my comment on that. But I think I'm at a point where I'm so tired of this, I just want to get out of this because I want the island back. So I really don't care what test they use. And if the car score, if they're going to use that as fabricated matrix for how they want to do it, it doesn't really matter to me. But just know that when you use the antigen test, there is going to be, areas where you're going to have, a false negative test that comes up. So it gives you a false sense of security. And I think that's going to be a big issue for Guam when it comes time for that. So those are my comments on that. So as far as I know, I think it's time that, we move on. I think we have a new president that's in place. And let's roll because I think it's time that Guam open up, and I think we can do it safely. I do not think the antigen test is going to be the answer to it, but if you're going to use the antigen test, I think the BD antigen test is actually the superior test, and I think even Hoa would agree that AMC has about 6 of those machines. Majority of the clinic actually has a BD antigen test. So I encourage them to use it, use whatever testing capacity they have, but certainly the Bionex has its failures. So if you're going to do that, you got to do serial testing, not in a mass testing arena.
Let's go ahead and get Dr. Hoa on here. Doc, I guess just first of all, if you wanted to respond to Dr. Shieh's comments about CAR score, which I believe he just called a fabricated
Matrix.
matrix.
Yeah.
Morning, Doc.
Yeah, good morning, guys. Hi. Okay, so, we have to understand some things. When we talk about something that the CAR score, the entry test, you have to have really a knowledge of what's going on before you talk. You know, the CAR score is not fabricated. We use three metrics there in the community to try to gauge something that we can actually measure. That's the new case per 100,000, the positive rate, and the spread. Those three are very important for anybody to kind of look at it and see how well the community, how well the diseases in the community at this point, and how we control them. And the CAR score really correlate what we see in the clinic. Tier 2 and tier 3 clinic, it's just like the pulse of the COVID-19 and Guam. We know when it's go up, and we let public health know we know when it's coming down. The CAR score, for the reason that it was very high in the past few weeks, because there's a home cluster that you have hundreds positive in one day because of construction and because of DOC. So you're going to see the number rise very high, and then once the cluster has been controlled, it come down to CAR score very nicely, to where we are at 3 to 4% at this point. Just I tell my clinic, this is the last 2 days is that the first time that we see, as many sick visits we see, that we have 0 case of positive in the clinic. That's just amazing. It's correlates so well with the CAR score that you have to know that it's used for purpose, and it set the goal for the community to abide by it and look at it and say, hey, we can do this thing less than 5, so we can go somewhat some near normal for Christmas, right? And look like for like Thanksgiving, what the CAR score so far stay down, and I pray that it stay down like that, because I think our community understand and did take some precaution, because we should see a little bit of a rise in the positive case already, because we are on I think Wednesday now, so we have to this weekend to really find out. But a CAR score, everyone in the world use different way to judge it. We use this CAR score not to fabricate anything. It's just basically put a goal there so that everyone can strive to it and make sure that, hey, if we get less than 5 for a week or 2, we can relax some restriction, everything like that. But use some real number. You cannot fabricate those numbers. You cannot fabricate the number of positivity, the number of new case per 100,000. We cannot do the spread over 7 days. We cannot fabricate those. Those are real numbers you see. So I think that if you understand more about the CAR score, and we try to do more education on the public how to use that, it's a very useful tool. It's going to change in the future. Yes, it's dynamic. The any type of platform we use to judge the infection is dynamic. It changed, because just like the same thing we learned with this virus, it changed every day. We learn to change it. So it's going to be more adjustment of the CAR score on what criteria we use in the future. So I think that we have to try to work with it and make some understand, and not just to say it's fabricated. It's not. Those numbers are real number. Regarding antigen test, antigen test, everyone know, is not the gold standard. The gold standard for this thing is PCR testing. Now, the EUA, the FDA, emergency use of this thing, authorization, yes, it say the antigen test, they call a point of care. The point of care is something that you use in the clinic setting to identify sick visit in order to try to screen out the positive one in the clinic. But also, if you read the entire authorization, it had 2 things. Yes, you can use number 1 as serial in the place like in the dorm. okay, in the housing, just like the construction housing, to do serial testing in order to try to screen out the positive, because most of them, 60-70% are asymptomatic. So you want to screen those people out, you try to catch them in the serial testing. But it's also, number two, it tell you that in case where that you want to do the screening for asymptomatic patient, that number one is because the PCR, because the time lag behind, which will take about a day to run, and also it take a day or two for the positive, and you get to contact the patient, or the on the fee. And so if you have those two, because the cost or the duration of run the test to get back to the patient is a problem, then we authorization, the FDA EUA approval for the antigen test. We all know that it's not the most sensitive things. You will miss some true positive case in the asymptomatic people. You will miss about 30% of them. Okay, but like I say, when you have a situation where post Thanksgiving, okay, you expect things to rise, you need to use some antigen kit or some type of platform that you can screen hundreds of people, up to 1,000 people a day, and you can tell that they're positive or not in about 15 minutes, and you can notify the person at the spot. Okay, you don't have to wait for a day or two with the PCR testing. I think the strategy changed, and I think it's very good for public health to use those antigen tests at the mass testing at this point, when you need to do 100 tests or 1,000 tests a day, just so that way you can screen, catch, 60, 70% of the positive asymptomatic, which is better than do nothing at this point, or better to do the PCR and wait a day or two and miss those positive until you get a hold of them. So I think the antigen test is perfectly normal to use. Again, it's FDA approved way to use it. It's not an authorization. It's an approved use of it. And at the testing site, they do screening. I know, Sabrina, you went through that testing, and they ask you, you have any symptom of cough, cold, congestion, anything like that. And if you have any symptom and your antigen test is negative and doesn't make no sense, someone there will do the test again, but now it's going to be on the Abbott molecular test or ID, or you're going to swap a PCR, just confirm that.
That's exactly what happened with Sabrina.
At site they do that. So, they don't, if you have, you show up there, fever, cough and cold, and that antigen test is negative, they will swap you again to run on the other platform to confirm that. So there's backup plan there at the site that they do in order to do it. But again,
but if the antigen tests were these Binax now are for symptomatic patients, why would I need to go back in if I had the symptoms and get a PCR test?
Yeah, Sabrina, sometimes the Binax antigen kit, they miss you even when you're symptomatic. The chain is that you go to the Binax, the Abbott ID, which will have the clinic, and you have the PCR. Sometimes even the Abbott ID will miss it, but the PCR test will be positive. So you have a kind of level of sensitivity that go up as you use different platform. So that's why when you, even with Abbott ID, that if it doesn't make sense to us, we're going to swap you and run on the PCR testing. So it's just a level of sensitivity that we have to work up based on the suspicious of your symptoms. So that's the reason why, like I say, it's really hard to run PCR testing on 700-800 people a day, and have to keep up with notify them. Typically, you can see that it takes a day or two or longer to notify someone that's positive, because all the work behind after you do the PCR testing. But when you have something that you can provide you a 10 to 15 minutes notification, especially if you wait there in your car when they call you or contact you, right away. So that's why the advantage of the antigen test is it really rapid, 10 to 15 minutes. And I say FDA, EUA, if you read the whole strip that they give to you, is one of the authorization that you can use that. in screening if you need to be. So it's not that you use something that they don't recommend.
Thank
It's
you.
a it's I think to say that.
Doc, let me go in real quick, and then we'll throw it back over to Dr. Shieh. We're KUAM FM and Agotnia, Guam. To our viewers on KUAM TV, jump back onto our Facebook Live feed, or you can catch the rest of the link on the breeze right here on the radio. Again, we're 93.9 FM. To our viewers on KUAM TV, there's a whole lot of great programming coming up. Or you could jump on the show and catch the rest of this interview. We've got a whole lot more coming up on the link. Like they say, miss a link, miss a lot. So come on in. The water's fine. My name's Chris.
I'm Sabrina.
KUAM TV. Hasta adios. And we are back here on the link. It's the Breeze 93.9. Dr. Shieh, did you want to respond to Dr. Hoa's response to your response?
Yeah, well, a couple of things. I think Dr. Hoa already admitted that the antigen test would miss about 30 to 40%, and that's what the data is showing us. So if you're going to use that missed 30 to 40%, and certainly if you imply that the CAR score is based on science, you're already missing 30 to 40%. So the inaccuracy or using the three-figured is already skewed. I mean, if you really want to look at the test positivity rate, you should be using one simple test. If you're going to stick with PCR, stick with PCR. But certainly the EUA does not indicate in the entire EUA authorization for mass testing, for schools, for serial testing, for a geriatric care. I think those situations, I think it's okay to use because you're testing the same person over a time period, weeks and weeks and weeks. That's what serial testing is. When you use it for mass testing, you use it for that one point in time. Sure, you're wearing the card. Oh yeah, your test is negative. But listen, we're gonna, 30% or 40% may be missed. So you may be positive that we don't know. So you give them that false sense of security. As far as contact tracing go, I do agree that we have to make a big improvement in contact tracing because to notify somebody who's 3 days later, that's inexcusable. And because of the lack of contact tracing, it's not an excuse to use a lower sensitivity to tests. And when you say the scores are not fabricated, I'm not saying the scores are fabricated. I'm just scores the actual test numbers are there. But the metric itself is a fabricated metrics because when you look at it, you're using antigen tests, which is you're going to miss already 30 to 40%. So if you're going to plug those numbers into your metrics, you're already going to be offset by 30 to 40%. Unless you tell me that if you test 50 positive and you add another 30 or 50% to the possible testing that you missed, maybe I think that if you can use that as a way to look at it. But you got to remember now, retransmission number in the metric that they use for CAR score is contingent on contact tracing, the efficiency of contact tracing, which is very poorly done in Guam. And even Hoa said you can't contact trace when you have hundreds of positives. Now, the people don't have control of who you test. So there is testing bias there, a selection bias as well. So I think overall, I don't pay attention to CAR score, and Hawaii certainly does it, and we're doing well here. When Hawaii did their pre-test arrival, there was a lot of criticism, and I'm sure a lot of people maybe hope they'll fail, but certainly it's been.
I think he's frozen.
What'd you do, Doc?
Success so far is
Okay,
opening up. I think Japan is actually going to.
Yeah, you're freezing, Doc. Not sure what's going on with Dr. Shieh, but Dr. Hoa, did you want to respond?
Yeah, like I said, when we antigen card in the mass testing, again, is one of the FDA EUA approved method of testing asymptomatic people. You have to actually read the whole FDA EUA approved authorization form. you just don't read just one sentence and then boom, that's all it used. So you have to have multiple. You have to read the whole thing. The whole thing authorized you to use on screening for asymptomatic people. Like I said, it's the best thing that we can use post Thanksgiving. That you can maximize the number of tests that you can do per day and have the result come out right away. So they do have some positive that coming out, the antigen test, mass testing, and they immediately isolate the patient. So that cut down the spread in the community. And they also run some kind of QC when you have a positive or you have a negative. They run both the specimen on the antigen and also on either the Abbott ID or the PCR, just to kind of correlate the negative and the positive so far. So far, every test that they run for correlation match up pretty well, 100%. And I think that they will try to finish or own the correlation and report that back in the next few days after they finish the testing. Again, it's an authorized use on the asymptomatic screening of the patient. So it's not like it's something that we just invented here. No, it's not. It's on the literature, it's on the insert for the Binax antigen kit. Like I said, we're gonna miss it. Even the PCR will miss it. Sometimes when you have patient that we see that have only the symptom, and the PCR test come back as negative, and we say, "Wow, this patient have everything." So, and not everything 100%, but I think we need to use the time where it's most likely efficient to use, and this is the perfect time. It cannot come in another time that we had. We just received 30,000, and I think we receive a lot more, and just during the time where the post Thanksgiving and Christmas coming, yes, we're gonna use everything in order to screen the positive one, in order to keep our community, safe. So it's very well thought use, and it's authorized use. They're not going to use something that is not indicated by the FDA EUA guideline, and that's what one guideline authorized you to do that.
So the FDA EUA said that it was okay to use on asymptomatic patients. That's what it says.
If you read through the insert on the Binax, midway through it tell you that's an authorized use to use it. Okay, I will send you a picture, a link, so you can read through that in the middle. In the middle, it will give you the use asymptomatic screening. So I will text you that insert from the Binax antigen card, so that way you know that what's it saying there in black and white is true. Preferably, like anything else, if you prefer choice is to use symptomatic patient only, but also that other choice you can use if you need to use it. So I will send that over to you.
Okay. Doc, do you know if this is being used at any nursing homes on Guam or at the prison?
Yeah. They're going to use that for serial use in the confined area, like the nursing home, like St. Dominic or DOC, so you can serial test people. That's another use of the Binax antigen card that's authorized, is serial testing of people to make sure that they don't convert. That's called surveillance, and that's so you can use that for surveillance to make sure that you screen out the asymptomatic positive person. So that's the third use of the antigen Binax card. So I'm very sure that they're going to use, but they're going to receive, I think, another few, like 100,000 this
Well,
ID.
I read
So,
the HHS website, and so it said Guam was allocated 50,000, and so we received the
yeah,
30.
yes.
So
So we're
hopefully we'll
going to
get the
receive
20.
yeah. So we receive a lot more than that. So we're gonna use it because it's really fast. Like I say, it's not a perfect system, and I want to make it clear, it's not perfect. We know that's not perfect, but this time, if we can catch, one or two or 10 out there that asymptomatic, it's good because those people can spread out the virus in the community, but they don't know about it. So anything better than nothing, right? So just I will tell my patient, if I can do something and save one person's life, it's well worth everything that we do. So there's a lot of criticism out there, but again, catching a few, one can spread out to many. So worth every bit of it.
Dr. Shieh?
Yeah, I have the FDA EUA right in front of me. If I can kind of go over that with you. For the EUA use is for symptomatics. In fact, public health themselves, and this is where the constructive criticism that I've given to public health is that they issued a memo to all the doctors and saying that if you're going to use this Binax card, the $5 card, we want you to use it only for symptomatic patients. I've asked them to change that memo, and I haven't seen it change yet. But yet they use it on people who are asymptomatic. So that is a inconsistent message that they provided to us. When I asked the CDC representative on Guam, why is that the case? And he mentioned that, well, that's the case because we don't want the clinics to be doing it for free. You can do the test for free, but we want the sick patient to come in so you can charge for the sick visit. To me, that's not an indication to use it or to use the memo in that situations. Now, I have the actual FDA EUA authorization in front of me. Now, here is what it says, okay? It says FDA has clarified the POC point of care antigen test program for the use of asymptomatic in certain situations. In this entire paragraph, it does not mention one bit about using it for mass testing. It does not. What it does state is that you can use it, basically, in summary, if your contact tracing is prolonged or the return time is prolonged, healthcare providers may consider the use of a less sensitive point of care test, even if they do not specifically authorize the use as off-label for congregate care setting. That's what it says. For congregate care setting like nursing homes or similar settings. For repeated use of PCR tests may be superior to overall infection control. That's what it says. Basically, what it says is using it in a congregate setting for serial testing. A mass testing is not EUA authorized by the FDA. So, we can sit here and argue about this point about using this test. I'm not against using this test. What I'm saying is that if you're going to use this test for mass testing, this is what I would suggest. And I'll give another constructive. If you have coming out to test in Dedido, I want you to take their names down and have them come back again a week later to do the same test. And then that's what you call serial testing. And that is what I think is do serial testing, not for mass testing. Mass testing is only at one point in time, you get tested, oh, you're negative, go on your way. You never ask that same person to come back to get retested. So if you're gonna do this, use this particular test for EUA authorized use, and if you're gonna use it for off-label use for asymptomatic patients, then I would do the same thing as you would do in a clinic for serial testing. And that's what the recommendation that I would give. And I think the Surgeon General will agree with that. But to use it for EUA, as far as saying, hey, that if you read the entire paragraph, it does not say nothing in the paragraph has said it's being used for mass testing. So if you're gonna use the data, the numbers that you use for the antigen test and plug that into the CAR score, you're not getting the full community spread. You're just not. That's why you see the CAR score all of a sudden go from 45 down to 27, down to less than 5 or in a week or two, because the score that you're putting in is not the accurate infection rate. That is not what it is, because you're using antigens now for mass testing. So you have to use that for serial testing. We use antigen testing for testing staff members, for nursing homes, etc. That's what you can use this for, and that's what the effectiveness is. If you're going to use it on asymptomatics, but again, going back, I really don't. At this point in time, I really don't think they're going to listen to me anyway, Sabrina. So I'm like talking about into thin air. I don't have any authority. But if you based on consistency and inconsistency, again, read the public health memo. It says use it on symptomatics only, and then they go out and use the asymptomatics. So I'm hoping they will change that memo. But if you're going to do that, you got to test it serially. You test it one time. You tell the person, hey, you got to publicly inform the people you're testing that if you're going to go to the Deredo or Tomuning and get this antigen cartridge, you have to tell them, hey, we're going to miss about 30 to 40% of you. So don't just leave here and say, hey, you're negative. Aloha, see you later. Have a day. I think what you should do is to take their name down and come back next week, test again. And you have to log that down and do the serial testing that way. I think that's a constructive input from me to public. It's not a criticism. I think if you follow that, I think you're going to be able to open up a little easier, but it's going to be difficult to do serial testing as a mass testing situation. But this Binax is not being used for mass testing. This is not the way to do it.
Dr. Ho, is that the strategy? I mean, when we had on Janella, she said they re-strategized how they were going to do testing, and so by having this mass community testing this week, they're hoping to have it every week and thereafter. Is that what you guys are doing? Is that the plan? The new plan?
Yeah,
so that it's serial.
We will use this to the best ability that we can use it. Like I say, that's one the authorization that we can use. And again, I will send you to the site so you can look at it yourself. But again, like I say, when you do 700 tests and look like people are turning out for that, so we really appreciate people doing that, but they care when they turn out. So basically, like I said, we catch the positive, the asymptomatic, and again, everyone that you catch, you will save the spreading in the community. So it's not everything, like I say, it's not perfect, but we have to use it to the most we can. Again, to do a PCR testing, 700-800 of the tests out there for screening. You can run that many PCR tests per day and be able to get back to the people right away. So I say you will miss some, and I tell you will miss some, but very few. But again, everyone that we catch is positive. They will save the spread in the community. And again, every Binax positive, yeah, they correlate that again with the PCR testing to make sure that it's not a false positive for these asymptomatic people. And so far, they correlate pretty well with the PCR testing. So I tell you, it's not the best, but it's the best use at this time. That's why I can tell you is that all the positive they catch at the site for the mass testing, just think about it. One person can spread to the next person and it's multiplied. So for us to do that is very good. And the CAR score, Dr. Shieh got to understand, like I told you already, is that, the CAR score is super high in the past few weeks just because there's a huge cluster on 300-400 positive per day. It will screw that CAR score very high. But again, the CAR score is very down and low at this point, and it does correlate with the clinic visit. Again, it's very hard to have 2 consecutive days that we have 0 positive, as many people that come through the clinic for sick visit. That telling you that we are improving, and we are improving because the community are doing this, their responsibility. So again, we hope that it continue to be 0 in the clinic for the next few days to next month, Tuesday. So we know the Thanksgiving people do listen. A few people that criticize, they do listen, and we don't have the big rise, the big surge that we expected, which is kudos for the whole community of Guam. Again, you know, everyone try to do everything that they have in the pocket just to try to do the best to screen out and do the right thing for Guam. So I think that to criticize every a step that the public health does to the key and to be perfect. Nothing in life is perfect. You know, we are going through this thing, and we can use everything we can to try to keep Guam safe. So to me, I say it's not my idea, but I think that's public health did a wonderful thought. They put a lot of thought there on this mass screening, and the timing is correct. So that's good for them. So,
Thank
and
you.
we're here just to help. You know, just
Yeah,
to
I
make
don't even
sure that-
understand the car score, but it is what it is, and whatever.
Okay,
Yeah.
Sabrina, I'm going to have to go, but you know, it's not the one last comment is that it's not the false positive that I'm concerned about. It's the false negatives. And we already agreed, and Hoa said that, you know, you're going to miss about 30 to 40%. So those are the ones that I get concerned about, is the one that we miss. I'm not concerned about the ones we catch. But, you know, I think moving forward, let's get out of this. One last comment is that we got to start locking up our arrivals, because our arrivals are less than 0.003 positive. All right, gotta go. Baby Maui's waiting. Aloha.
Okay, see you,
Thanks,
Doc.
Dr. Shay.
Okay.
All right. Merry
Thanks.
Christmas, Hoa. See you later. Bye-bye.
Dr. Hoa,
Yeah. So we do.
I did want to ask you about the CDC and their recommendations and their changes to the quarantine. Did you hear about that?
Yeah.
Their
Yeah, I mean, they
new guidelines.
from the 14 days to 7 to 10 days. So, I mean, we were hoping they change that to 1 week. And that's what we've been doing in the past few months, is that if you test out negative on day number 6, that you can relax the quarantine. So I think 14 days is way too long, and I'm very happy that CDC will consider shortening it. So we're looking for that, and we will wait for that. Regarding quarantine, yeah, I mean, there's a lot of discussion. We're going to talk on the pack and give advice to try to do something different, either before the holiday or after the holiday, that we can basically let people quarantine at home. Depend on, you know, how we do with the positive rate in the community, right? So yeah, we're looking forward to do that. We talk about, you know, require everyone to come in to have a pre-arriving PCR, or if they don't do that, we might make them pay at the airport to do PCR. So whatever it is, to try to encourage people to do the pre-arrival PCR so they can get here. So there's a lot of discussion, a lot of detail we have to go through with, you know, the Surgeon Cell Public Health in order to see if we can change our quarantine guideline here in Guam. As I said before, after the holiday, but it really depends on what we see the next week or so.
Right.
So, and again, you know, if we can keep the positive rate, the CAR score down, which we did in the past few days, and to me, I'll let you know if we see a rise in case positive in the clinic. But I say, if we don't, then we are actually doing very well. And again, if we do very well, thank you a lot for the community for doing it. It's everyone's effort.
So do you know, the governor indicated when Chris talked to her on Giving Tuesday that if the CAR score remains below 5,
Yeah.
that we could see further easing of restrictions around December 15th, 16th, and I think 17th. And if she does that, do you foresee the lifting of this PCOR 1 designation? Or does it even matter anymore?
Yeah, I think that if we keep this thing down, the lot of restrictions have been lifted, and we got to go back and look again on the definition of PCOR 1 and 2, and because right now we do so much modification that is really don't fit in the criteria of Pico 1. So and because we
What
have
about
to move
Picor
on.
Fun? Does it fit into that criteria?
I I think as long as we lift some restriction, especially if I want to go out and eat, right? And as long as we do that, it doesn't matter what people we are in, we are open up and relax some restrictions. So it's
Yeah.
okay. It doesn't matter what you call it, right?
Have you
So
heard of any fines or penalties that have been issued?
I don't think so. I don't think there's no
Okay.
fine yet. I tell you
So
either
everybody's
there's
doing a
no.
good job.
I know they do a lot of inspection, but I don't hear anyone get fined yet. So that means that people listen, and that's the thing that we try to do. Again, like I tell you guys before, it's not the fine or the penalty that enforce it that makes us better. It's the people. If we follow the guideline, what we do, we don't need any fine or any violation on that kind of stuff, any
Yeah.
penalty.
So
So far, we're doing good.
tonight, you guys are the PAGS meeting. You mentioned last week
Yeah.
that
Yeah,
arrival testing at the
yeah,
airport.
we're gonna meet tonight. That's one of the topic we're gonna discuss a lot. We have surgeons out there, we have public health there, so we're gonna discuss that in great detail because we need to give the governor the advice and what we want to do next. So we will spend a lot of time on those.
Vaccines? Anything on vaccines? Saipan, they got the cold storage units already arrived.
Yeah, I think that the vaccine, they have that team to work on it, and they have ability to store this vaccine. Just now coming up with a plan to how to distribute it out to the public and who will get first and all that kind of stuff. So
we have the ability to store the vaccines. Is that what you said?
Yeah, we have. I think we have like 3 or 4 of those very cold storage unit, so we can store them.
The government or who has those?
I think the government have it. So that's what I heard yesterday. But again, the key is to how to distribute it to either the clinic or the site and who identify who's going to get first, who's priority. Beside the healthcare worker, the highest risk is the dialysis patient. So those guys will go first just because we have to protect them.
Right.
So something that we have to come up with a careful plan, the priority list, so we can give to the people that really need it first.
Yeah. Have you heard when or how many vaccines we're getting?
I don't know. I heard some case about 3,000 to 4,000 at first, but sometime in December. So it's coming. Like I say, people, and it's going to change the norm. And but remember, people got to understand. You get a vaccine just like any other vaccine. You get a vaccine that will protect you, but doesn't mean that you drop everything you do. You still have to take precaution. We can go back to some new normal, but you have to take precaution. And just like any vaccine, right, protect you if you have it. Hopefully your symptom won't be as bad as you don't have. So can you still get sick? Yes, you can. Just like the flu vaccine. Right. You can get the flu vaccine protect you, but when you get sick, hopefully the symptom is not as severe and you don't end up in the hospital. So
hopefully you don't turn into a zombie, Doc. That's what the real concern is.
Yeah. Well, hopefully not, but I think that they.
What's the percentage, though? What do you think is the percentage of if you take the vaccine, you're going to turn into a zombie? That's
Chris, this, okay? If they have it, we'll have it.
Okay.
I'll get the. No,
I want to let the people. I think we should guinea pig on some naughty people first, and then how they do. We'll monitor them. Okay, they're good. All right, give it to them, and I'll go.
Okay, well, they have to volunteer first, but I will get it when they get here. Not hesitate to do that.
Thank you, Doc. Appreciate it. Thanks for going on with Dr. Shieh.
Yeah. It's okay.
Thanks for taking care of Dr. Cabrera's light work for him.
We'll catch up with you tomorrow so
Yeah.
you can give us an update on the meeting tonight.
Can you come on tomorrow to give us an update on the meeting tonight?
Okay.
Thank you.
I tried. Okay.
All
We
right.
have a lot of things to do. I have a meeting with you tomorrow on the Zoom with the GHRA anyway. So
Right.
I'm
Oh,
studying something.
yeah, that's right. Oh, that's who's coming on tomorrow. Darn it.
All right.
All right.
Okay.
Thank you, Doc.
See you tomorrow.
Okay, we'll
Okay.
see you.
Bye-bye.
Okay,
Bye.
Dr. Hoa. There you go. Dr. Hoa Nguyen. Very civil discussion, right? With him and Dr. Shieh. I was expecting a little more fireworks, but hey, it is what it is. Just glad to get a little counterpoint about the testing, Bree. And, Dr. Shieh raised that point about the CAR score and how they calculate it and how the contact tracing is a part of it. I thought that was interesting because Dr. Hoa has been critical of the contact tracing with public health. And I think you hear from a lot of people. I mean, first of all, I'm not even sure how contact tracing is involved with the CAR score, but I'm just talking about the contact tracing specifically. Like when my son had COVID, he didn't even get a call till like 12 days after he tested positive. So, and that's not even the only one. I hear so many people message me and say, hey, we tested positive. They never followed up on us. So that's definitely an area that needs improvement, whether or not it's part of what's calculated into the CAR score.
For me, when I was waiting for my PCR test results, I wasn't sure how long it was going to take for them to call. So I just called yesterday. I called 311. And
How was that?
I had to listen to Crystal giving the option instructions. And so I think it was press 1. So I pressed it. And then I think it was Debbie. And she took down my information. And like maybe 2-3 hours later, I got the phone call that was negative. So, I mean, it seemed efficient. I mean, I wonder if I didn't call, would they have called?
Yeah, I just think it's interesting that we got these new Binex tests. And, the
Binex now.
Yeah, the Binex now. The accuracy, though, of the COVID-19 tests, no matter what test it is, no matter what name it goes by, that's always been an issue since the pandemic started. I remember there was Abbott had the false negatives or false positives or something. So even going back with all the different tests that we use, the accuracy has always been a big question mark. And so I thought it was interesting that we had all these people on the show talking about this great Binex Now test. And then when you went to go get tested, it turns out that they give you the Binex Now, but then they also give you another test because they're not really sure about the accuracy of the Binex Now. So.
Right. And like I mentioned earlier, the Binex Now, like Dr. Shieh was saying, that it was for asymptomatic I'm not symptomatic people.
Right,
and
yeah.
so if I supposedly had the symptoms of COVID, why do I need another test? If that's what they were supposedly specifically designed for. And Janella, when she was on, she said, yes, they were for symptomatic patients. But because the U.S. Surgeon General said that you can use antigen tests for I guess, mass testing, then it's okay. So, yeah, I'd like to see it in writing, what Dr. Ho was referring to, that the FDA authorization said that it was for some asymptomatic patients as well.
Right. Yeah. We take a break, or you want to go to Command Sergeant?
I just want to say, people, though, go and get tested. Go take advantage.
Yeah.
Of it doesn't hurt. It's just a couple of swabs.
You sure it doesn't hurt? Because when I watched your video, I was very afraid.
PCR
I was very
one
afraid.
was the one that kind of hurt, but the antigen, it didn't hurt. It was really quick.
The Binex Now.
Yeah, the Binex Now.
Right.
And if, like you said, if it's supposed to be for serial testing, then do it this week and then go back next week.
All right. I wanted to just read a couple of the comments here, Jay, before we jump into that. Our friend Glenn writes, we still must be diligent on protecting ourselves, even if the CAR score is low.
Exactly.
Amen to that. Marie Regis writes, we all know a negative test, even PCR, doesn't mean we're free. We still need to wear masks and social distance. That's the other thing I wanted to say about with the testing. Sometimes it's not even an issue of the test is accurate or the test is not accurate. It all can be very contingent upon your exposure timeline with the virus. So, like, for example, Bree could have went and got tested and been negative, but she doesn't have enough of the cooties of the virus in her to test positive, and a couple days later, same person, same circumstance could be positive. So that's always even been an issue. Like if you guys come into close contact, they'll ask you like, well, when do you think you came into contact with them? And they're not going to test you right there. They'll say, oh, okay, let's see, 1, 2, 3, 4, 5, 6. Come in and get tested on Tuesday and monitor yourself for symptoms, because by Tuesday, if you got it after being exposed, it'll show up on the test. So there's a lot of stuff that's at play with these tests. And I'm not even a doctor. I've just been paying attention. So what else we got here? Paloma writes, aren't we all zombies at this point? Teresa Camacho says, yes, they never said to stop the 3 Ws, even if the car score is low.
Yep.
We all still need to stay safe. Chamarita writes, that's our lifestyle now.
Yeah, I just think there's just a lot of confusion with the car score, and that's why people are kind of criticizing it, I guess you could say, or giving their opinion about it. Because,
which they're totally entitled to do.
Yeah. I mean, even I have issues with it, but, I guess we have to do this, and that's the way it is.
I mean, yeah, there's issues with it. I'm just going to say, of course, we got issues with it, but, I mean, I just think that I agree with some of these comments that no matter what the car score says, we just still got to be safe and maintain the social distance. Because there's a couple things at play here that I think it's dangerous to discount the seriousness of the, the contagiousness of the virus. Is we've got this car score campaign, which is obviously it's running full speed ahead.
Yeah.
And we're under 5. And I mean, if things keep up this way, they're going to lift restrictions by mid-month.
But they definitely should change this whole P-Core.
Yeah, this P-Core one's a joke. It's a joke. It's a big joke. And then the other thing is this talk of this vaccine. So I feel like there are people out there like, oh, well, we're gonna get the vaccine. Yeah, no, gun it. You know what I mean? So I think it's very crucial that, and our audience has been really good about, heeding the protocols and, talking about doing what we have to do. So I think that's key, is that let's not blow it before the vaccine comes. No matter what the freaking car score is, let's just hunker it down. I want to see you guys in 2021.
It would just be nice to see if maybe public health or the governor's office, somebody just to hold a press conference just to explain this vaccine, the distribution plan, or what you're working on, when we are anticipated to get it, how many, who's going to get it. Just to kind of allay the concerns and just shut down what people are saying, because nobody really knows.
Yeah. Well,
you hear it here, then you hear it there, and then you hear it here.
Yeah. I mean, I've heard 3 different timelines and, 3 different days. But you're right. They should have like a press conference or something. But, instead of that, we got a video. They put out another video, which and we'll talk about this later because Jay's giving me dirty looks.